This government meeting is brought to you by Eastworks and our local cable subscribers.
Before we get started, I just want to, before we start with public speak time, just want to establish a few rules in accordance with the Mass General Law. We are required to let you know that this meeting is being recorded. We will begin with the public comment of the meeting, and during that public comment, speak time is limited to 5 minutes per person. We will also be conducting a public hearing this meeting, which there will be public speak time for that particular topic when we open that portion of the meeting. If you have a topic of discussion that is not on tonight's agenda, please let us know so we can address that at our next so that we can put it on our next month agenda. And please remember to be civil during public comment. And with that being said, we'll open the meeting with general public speak time, allowing about 5 minutes for each person if there is anyone for the general agenda of the meeting. And I would ask that you, sorry, I forget we're always doing virtual, use the hand raise portion if you do want to speak. This also includes all the board members and the director and inspector of the health department. Okay, so I don't see anyone for public speak. Do we want to move on to approving last month's meeting? I think that was just Amy and I for that meeting, correct? Yep.
No, I was there too.
Oh, get it all. Summer has flown by. So did everybody?
Oh, I wasn't at that meeting.
Oh, I knew someone. I knew it was just two people. So did everybody get a chance to review the minutes? Any concerns, questions, remarks?
Nope, I reviewed them and I have no concerns.
Okay. Do we want to make a motion to approve those minutes?
Yes. Can you just remind me of the date of that meeting? So
it was August. Yep, August 2nd, 2023.
Okay, I'll make a motion to approve the meeting minutes from the Board of Health meeting on August 2nd, 2023.
I second that motion. All in favor? Maggie, yes.
Beth, yes.
Amy abstain.
Okay, so next item on the agenda is the director's update. So, Allison.
Hey, everybody. And I think, Amy, this might be our first meeting together. So nice to be here together. Thanks. So I sent everybody an actual copy for the member to copy prior to the meeting. I just have a few updates on staffing for the department. So we have a new public health nurse starting on October 10th. I've gotten her first start date. She wasn't able to attend the meeting tonight. She previously scheduled appointment, but she'll be at our next October meeting on October 15th. Her name is Christine Southworth. You might know her or be familiar with her. She's currently the public health excellence regional nurse for the town of Southwick and a few surrounding towns in that region. So she has really good experience around managing MAVEN cases and flu clinics and doing home visits and things like that, and working with local boards of health. And she's a resident of Southampton. So she's close by and really familiar with this position. And yeah, we're excited about her and excited to have her join the team. Let's see here. I'll skip ahead just one section. So Healthy Youth Coalition update. So Ann and Rebecca have both left their positions with the Easthampton Healthy Youth Coalition, which is a grant funded through the CDC, overseen by the health department in Easthampton, and moved on to be the middle school health teacher in the Easthampton School District. And Rebecca is working now with the town of Ware. We had to take action to terminate Rebecca's position a little bit earlier than her anticipated end date. There was a concerning incident in the community, and amongst me and HR and the mayor, it was determined, and also the partner agency that sent us the report, it was determined that it was better for us to terminate her position sooner than her anticipated end date. So we have that position posted, the grant coordinator posted on our website now. And we may be posting an additional full-time family and youth engagement coordinator in the next couple of weeks, but we're still sort of regrouping on what funding is still left. And it's the last year of that grant. It's year 10. We're going into year 10. So I'm trying to figure out somewhat of a sustainability plan and see which components of the grant that currently exists that we might want to continue into the future. There's some really strong community partnerships, especially with SPIFFy, the Strategic Planning Initiative for Family and Youth, based in Northampton, in Easthampton School District. So I'm really determined to hold on to those partnerships and see if there's a way we can continue some of the good programming beyond this next year. Let's see here. So Liz Kloop, our social worker, is currently on maternity leave, as you probably have heard, but if you didn't, we had twins at the beginning of August. And so she's out mostly until the end of the year. She'll have some part-time hours starting in a couple of months, but for the most part, she'll be out until around the holidays.
Great. That's exciting news.
Yeah. Great. Yeah. The babies' names are Sydney and Simone. And yeah, I think she's doing really well, but I'm trying not to bug her. So, and everybody in the department, and also Emma Wright, social worker with the police department, we've all been sort of taking components of her position, but she was a very busy person in the department and saw a lot of cases. So we'll be happy to have her back when she comes back, but can be patient until then. So let's see here. One thing I did want to mention is the public health core in Massachusetts. It's an initiative through the state and a bunch of colleges and universities with public health students, I think undergrad and grad students, that are looking for projects to assist local public health in Massachusetts. They sent out a call for project ideas, and I requested some assistance from a group of students to help us develop a youth engagement needs assessment in Easthampton. And that's sort of to help us evaluate the program for the Healthy Youth Coalition, but also to help us hear directly from the youth in Easthampton what they want to see coming from the city. Like, what assistance do they need? Do they need more social work capacity? Do they need more, family, parent focused education, more opportunities for just like hanging out and things to do after school? So we'll be working with students through the colleges and universities through that public health core to develop that plan over the winter, and then hopefully able to implement it beginning next spring. Start pushing it out there. The next section is the expansion of infectional services and staffing. So I think Bree and Brian, Bree, the former director, hey Bree, you're here, and and Brian previously identified the need for an additional part-time inspector. It's definitely still a need in the city. So we are in the process. I'm working with HR right now to get the ball rolling, to get a new position approved by the city council. Mayor's approved funding once the city council approves the new position for the department of a part-time health inspector. And I'm hopeful that we'll be able to post that position and go out to hiring in the next couple of months. So that'll be good capacity to add. And then among Brian and Jackie and myself, we've all been discussing about the need to just add efficiencies to the inspectional program. So doing electronic permit applications through, Permit Eyes on the city's website, online payment options for vendors to pay fees like renewal fees and stuff, and looking into opportunities for electronic inspection software, which we might be able to get cost-free through the Public Health Excellence Grant, or we might choose to go out and purchase our own software. I'm still sort of waiting from the Public Health Excellence people about what the program is and how we could get a membership for the software that they're like bulk purchasing.
Right.
So the plan is sort of like get the new staff person on, get the electronic inspectional and payment and permit application stuff going, like all implemented in the next year. But hopefully the staff person is hired sooner rather than later so we can get them trained up.
Yep. Sounds like a good plan.
Yeah. Flu clinic. So we have 3 flu clinics planned for this fall. We have a private municipal school department staff person clinic coming up. Let's see here. We have a public clinic being held on October 21st from 8 a.m. to 12 p.m., which is a drive-through one at the Public Safety Building. And then we've got at the Council on Aging coming up to, I think that's the 25th. And we've also got a homebound vaccination program with the Public Health Excellence regional nurses through the Northampton Department of Health. And so Jackie and I are sort of helping people sign up for those homebound vaccine visits. And then the nurses reach out to the individual requesting the vaccine nurse visit. And there's an option for that resident to be, or for the nurse to be accompanied by a member of the fire department. To do just a general checkup and be a familiar first face present for the visit. So that's been a good process. And then the vaccine reimbursement. So this is kind of an ongoing conversation we've been having about vaccine reimbursement sort of over the COVID period and then sort of moving forward into the flu clinic season. So Easthampton is not currently a vaccine provider. Sorry, I don't have like the actual term for that at the top of my head. Maybe Amy, you know that, what is the term when it can be the purchaser of vaccine and actually like do the cold chain management?
I don't know what term you're thinking of.
Yeah, I'm sorry.
A vaccine provider who can purchase and reimbursements.
So basically, the city of Easthampton can't purchase vaccine through the state program and then distribute it out. Easthampton has always gotten their vaccine supply through, from what I understand, through the Northampton sort of like regional program. And what happens when you do vaccines out in the community, for people who have insurance, they submit their insurance, and then there's a reimbursement that goes back to the agency that purchased the vaccine initially, not necessarily the people who administered the vaccine dose, but the people who purchased it did the admin and the cold chain management for that vaccine. And so there was a question of, based on what other communities do. I'm from the Berkshires, and we tended to redistribute the reimbursement fund out to the agencies who actually did the administration of the vaccine. Usually, not all the time. If we were using staff from like an ambulance service or nurses from another department, they would get some of the reimbursement. And so I just asked that question when I came into Northampton. I was curious if Easthampton ever got partial reimbursement when Bridget was doing vaccines, or that the fire department had many of their paramedics doing vaccine administration for, probably thousands and thousands of doses over the last few years. And so the answer is, what I understand is no, that all of the reimbursements have gone back to Northampton, which is a system that has just been in place, and that's how things have been done in this region. And so the option, from what I understand, would be if Easthampton wanted to become a purchaser or like a administrator of vaccines, we could do that. We could go through that process. It's a little bit arduous at the beginning. And it's not uncomplicated to do the cold chain management and admin piece of being a purchaser, but it would be an option if the board wanted to move forward with that. And
have we done an analysis of what it is we'd be gaining by doing that?
For actual cost, right,
like the number of vaccines that we've given over the last 5 years averaged out versus what we would have received in a refund, to see, because there is extra work required in that. So does the cost outweigh the benefit of receiving that extra money into Easthampton, given the extra work that it's going to take to be the vaccine administrator of the?
Absolutely. That's a great question.
So basically in our return of investment. Yep.
Yeah, so Bridget was really diligent about tracking how many vaccines were administered during COVID and flu, but it's hard to, I wouldn't want to extrapolate that information necessarily to a typical flu vaccine clinic. I think in a typical season, we'll probably vaccinate, I don't know, and Bree, maybe you have a better estimation of the number, but somewhere between 500 and 1,000 doses. And I think depending on the actual vaccine, the reimbursement rate and Medicare versus private insurance versus Mass Health and Medicaid, it's all sort of different. I haven't done the full analysis yet, but I'm happy to put that
is that it's not going to, I think what Northampton does for us is remarkably generous by doing all of that work. And oftentimes you're going back and forth and not getting the refunds you needed. And it's a year delayed. So you're traveling through fiscal years, and it just is a headache. And the Northampton helped me out as well when I was in East Longmeadow. And so I would guess that the work that is behind that for the refunds or reimbursements that we're going to get is probably not worth it. But if you wanted to bring numbers, we could certainly look at it.
Yeah, we can look at it in the future. We wouldn't be able to do anything now anyway, because we don't have a public health nurse and all those things. So, let's set that for a future agenda. When we're
I'm happy to put. Oh, I'm sorry, Maggie.
Go ahead. It's all right.
I'm happy to put the numbers together, but I agree with Amy. Right now, we just don't have the capacity. And if for some reason over the next several years, our program grows and grows, we have 2 or 3 public health nurses, I don't really see it that big. But if we did get to that point, we might consider it and have just greater capacity for that type of program. Brian, I was going to cover a brief on tobacco violations. Do you want to do that in your report, or I can return to that section of my report following your update? Oh, you're muted.
Sorry. I'm not sure if you had anything like any notes made up or anything like that to follow off of. I don't have anything tobacco related on my update. So,
I can go over it now. Yeah.
So why don't we go to Brian's update, because then we can move right into the public hearing, and you can start with your piece at that point, Allison. Does that
Perfect.
sound okay?
Yep.
okay. So for me, after a busy summer of camp inspections and a lot of housing cases, I'm starting to shift my focus towards food inspections again. We currently have roughly about 100 food establishments permitted. About 60 of them should be inspected twice a year. But we're currently on track to get in most likely at least once in the door this year for all the establishments. Over the summer, there were a couple new establishments that opened up. Valley Art Supplies on Cottage Street, they're an art store. They opened up a bar in their store. So that recently opened. And then 2 weeks ago, Starbucks opened up. Last week, there was a plumbing issue. There was a sewage blockage that caused us to have to close the store over the weekend. But I reopened them yesterday, so everything's hopefully squared away with that. This time of year, we have a lot of temporary food events, a lot of festivals. Just this, past weekend, there was Arcadia and Millside Live concert series the past couple weeks as well. Food Truck Friday still going on, and this time of year too, we have a lot of festivals and craft fairs, etc. Moving on to body art. So I recently started to catch up on those inspections as well. We are required to inspect them twice a year, but again, with the food, we'll most likely end up being at least once for each one. We currently have 6 permitted body art establishments. We've had a couple smaller, like 1 or 2 artist studios open up over the past couple of years. I think they're artists that have branched off from like Oxbow and Black Labyrinth, the pre-existing ones, and they've created their own, opened up their own shops. And then Allison, I wanted to ask you, the next part of my updates, just housing on 140 Everett and Federal Street. I noticed that's on the agenda. Did you want me to go over it now, or did you want to wait until we get to that agenda item?
You're on mute.
Sorry about that. I'm on the phone here. Apologize. Brian, why don't you go ahead, Maggie, if it's okay with the board, if we can bump that housing update up. It's pretty brief.
Yeah, we can do, let's just include that in Brian's update, and then we can move on to the public hearing.
We should make a motion to move out of order then on the agenda.
Oh, yep, you're right, because it is on there.
So we could make a motion to move it, or we could just have Brian hold and do it in the order, because he's going to be here anyways, whatever you guys want.
Oh, let's just hold till after then. That's easier.
Okay, yeah. That's pretty much it for my update, and then I'll go over the housing stuff after.
Okay. All right, so we need to make a motion to close this portion of the meeting and open up the public hearing for Valley Farms.
Actually, suspend, not close.
Oh, suspend. Correct. Thank you, Jackie, for keeping me on my toes.
Sorry.
So
I'll make a motion to suspend this portion of the meeting at 5:56 p.m.
I'll second.
all in favor, Maggie, yes.
Amy, yes.
Beth, yes.
And then, yep, go ahead.
I'll make a motion to open the public hearing at 5:56 p.m.
I second
Oh,
that motion. All in favor, Maggie, yes.
Amy, yes.
Beth, yes.
So I just want to reread sort of the similar to what I read at the beginning of the first part of the meeting. There will be a public speak time for Valley Farms that we will limit to 15 minutes. This is just a time for you to express your thoughts, views on the topic. We will not be responding to the public comments, but we will be listening. And once we suspend the public comments, then the board will discuss amongst themselves without input from Valley Farms, what we're going to do moving forward. And at that time, I just really want to remind everybody that your public speak time is done. If you really feel the urge to say something, please raise your hand and ask permission from myself, the chair. Same with anyone else in this meeting. And please remember to be civil during any public comments or any other interactions with anyone in this meeting. So I will leave that to Valley Farms. You can begin your public speak time at 5:58 p.m.
They're on mute.
Maggie, he raised his hand.
Oh, sorry, why can't I? Oh, yes, there it is. Go ahead, Mr. Truex.
Truex, very good, yes. Madam Chair, Madam Director, members of the board, my name is Tom Truex. I'm an attorney up in Salem, Massachusetts, and I'm here on behalf of Valley Farms. I think I see Mrs. Patel. I'm not sure. They were both going to be in different places. I know Mr. Patel was going to be in Boston today with his daughter at the hospital, and I think he may be on the phone, but I'm not sure. In any event, just some preliminary, Brian and I have talked on this, and he's been kind enough to send me some information. So I've reviewed all the information, and I've reviewed the information with both Mr. and Mrs. Patel. Let me just preface by saying I've known the Patels for probably over 20 years. They have maybe a couple dozen stores in Western Massachusetts, Middle Massachusetts, Central Massachusetts. And to be honest, this is the first time I've ever had to appear for a violation, whether it's for tobacco or for liquor licenses, liquor violations, any of the sort, or even lottery violations. So this is the first for me for Patels. So they've had a clean record as it relates to any violations for any of the licenses they've held, and they hold a number. I mostly deal with the liquor licenses. This was a liquor license as well, and I appeared on their behalf for the beer and wine license here at the store. But again, let me just repeat that and reiterate the fact that, as I've told Brian, I've known the Patels for many years. They're hard workers. They usually run a tight ship. And there's clearly, this is one that they're not happy about, and it was one that went through the cracks. So as I told Brian, this was a closing done on April 14th, and as part of the closing, there was inventory that was taken. I'm looking at my settlement statement. It was $80,950 and change worth of inventory, and that included inventory for tobacco inventory. So Mr. Patel wasn't able to be at the inventory and wasn't there at the store opening. He had a manager there. He also had an inventory person that took care of the inventory and the inventory counting, as well as the taking care of the store at the beginning, including the inventory. So, he sincerely apologizes. He certainly didn't mean to have this happen. He doesn't want to be here, having to deal with this, but so he wants to express to the board that he's sincerely apologetic for what happened. This is not the way he runs his business. He runs a very tight ship, and he never has these things happen. This did happen, though. So in terms of, as I said, the inventory that was there, this was part of the tobacco inventory that was there that he inherited from the prior owner. So yes, it should have been taken off. If he had been there, he would have done it. His inventory person, his manager there, they didn't do it. So this one slipped through the cracks, and he fully admits it, and he fully ability for any of the violations. But as I mentioned to Brian, he has taken care of the signage. The signage, he sent me a picture of it, and I can send that to you. The signage has been taken care of. Obviously, someone from, I think, the Pioneer Valley gave him signage, and that should have been there. It wasn't there. He takes responsibility for that, but that's been corrected. As to the flavored tobaccos, that's all been removed. I can send you pictures of that, so that's been taken care of as well. It should have been there. He understands that. He certainly is aware of that, so he certainly apologizes for that. As to the failure of to maintain these records, these documentation, I have to admit I've never heard of that before, so I did read the regs, and the regs do mention the documentation to get from the manufacturer. So that's not possible to get from the manufacturer. So J. Polyp is their inventory, their distributor, their food supplier and tobacco supplier. So I reached out to which is Eric Scott. He's in charge of the tobacco. I have not gotten a call back. I've put 3 calls out to him. I'm waiting back for that. That would be the company that would be able to give that documentation. So that's the only thing we're working on to correct is the documentation. Again, I have to admit, I've been doing this for over 40 years, and I have thousands of stores that I've done closings for, and this is the first time I've run into this manufacturer's documentation. So this was a new one for me, learning on this as well. The only other thing I would just want to say is, as I mentioned to Brian, is that in reading the regs, again, I wasn't familiar with the regs because I haven't run into this violations before, but my reading of the regs is that a violation is per day, and I think that's in section 665-045E. So it's per day, and there was only 1 day on this for violations. So my only gripe would be that the violation should be a first offense, which Mr. Patel is more than willing to take care of immediately. And that would be it.
Through the chair.
Yep, go ahead, Amy.
Okay.
So is this in response to him during public speak time?
Oh, is this not when so when we go in,
make sure there's no one else that wants to speak during public speak time.
Okay.
And then we can adjourn that portion and start our own.
So if we start our deliberation before we ask questions, they can't then so we should ask our questions before we go into deliberation, right?
No, we can ask questions during our deliberation. They can respond, but they can't do any more of sort of public speak time. So go ahead, Lisa. I see your hand up.
Hi, my name is Lisa Stevens Goodnight. I'm the Director of Tobacco Control from the Massachusetts Municipal Association, and I provide technical assistance to tobacco control programs across the state in terms of enforcing and different parts of the law, especially under the new law. If you guys ever worked with DJ Wilson, I took over for him after he retired. So I just wanted to say some quick pieces in terms of, I spoke with Brian prior about the concern about the way that the fines are being issued. And I can say that there are other towns that do this kind of stacking system where each violation type at a single visit is is fined separately, basically. It is not, I will be honest, it's not the majority of towns and cities, but there are other towns and cities that do this, and it has held up on appeal before. In terms of the manufacturer documentation, that can be I know for a fact that J. Polyp has it, so it shouldn't be too much of a problem to get that and have it in the future. But it is a new part of the law, so I'm not surprised that it wasn't seen before. It's been since 2019 when they enacted the new law, but it was a new part after that. And also, I just wanted to, again, introduce myself. I work generally with tobacco control, and I'm a resource that's available in understanding and implementing the laws, especially, again, because there's a lot of new laws around after the 2019 update.
Is somebody like texting or something? I keep hearing that noise of sending a chat.
I'm researching regulations over here. I'm trying to figure out the 2019 regs. Sorry.
That's okay. Is there anyone else that would like to have any comment? Ms. Patel, go ahead.
Yes, so like I said, we have under new management, all the tobacco products we had previously was just sitting there, and now we already took them down, and we also put up the signs, and as required, all the signs and everything is there. We don't have any more tobacco products which not supposed to be there, and yeah. Just the last mistake that we need a just new chance. We have all new management. Also, the employee that we had previously, we already replaced them, and we have
Okay. Anyone else for public speak time?
When do we get the testimony from the tobacco control officer? Is that during public speak, or is that when we deliberate?
She can do it now.
Okay. I don't know I think they're on.
Here.
Is Donna or Meredith or someone from the tobacco control?
I thought I saw Donna and Meredith at one point.
Yep, Meredith. Yep, Meredith and Donna are both on. Are either of you able to speak to the Pioneer Valley Tobacco Control piece?
There's Donna.
I'm here. I'm not sure.
Oh, you got an echo.
Go ahead, Donna. Oh, she left the meeting.
Having problems.
Is Meredith here still?
She was a minute ago.
Yep, she's still on the roster. Meredith, are you able to speak?
Hi, yes, give me one moment. Donna disconnected by accident, and she has the testimony as she was tobacco control officer on scene.
Okay.
Perfect.
Sorry about that. Technical difficulties.
No problem.
Okay, I'm going to give Donna my phone because she can't log back in, and she'll provide testimony for you.
Okay, thanks, Meredith.
Okay, can you hear me okay?
Yes.
Okay, good evening, everyone. I'm Donna Bowman. I'm one of the TC tobacco compliance officers for Pioneer Valley Tobacco Coalition for about the last 5.5 years. Just wanted to give you some testimony on what happened on the day in question. I entered the store to do an education check, which is something we do twice a year with our establishments. we go in, we do things like check for signage, look to see if they have any product that should not be in the store, and speak with the clerks or the managers, the owners about some of the product they have. So on the day in question, when I entered the store, there was a manager on duty who I spoke with, and it should be noted at the time of the visit, there was the establishment was serving a suspension of their electronic nicotine delivery systems via the FDA. So there should not have been any electronic cigarettes on site at the time of visit. Upon arrival, there were many ends that were on the counter being sold, which were all flavored, and many of them were over the 35 milligram maximum. They were also selling flavored cigars, cigars under the pricing minimum, flavored chewing tobacco, flavored jewel pods, including mint. And many of the items offered would not ring up when I asked to check pricing. So I'm not sure what that is, but there was a handful of maybe 4 or 5 items that we checked that would not ring up. The clerk he stated he did not know why or how much they were. He didn't know why they wouldn't ring up. He didn't know how much the items cost. I asked to purchase some of the items. He refused to sell at that point because he realized he wasn't supposed to have them. I did ask if he had a price list for reference. He said at that point, he said no. He just said he didn't understand why they had these products on the shelf to begin with. At that point, I just had a discussion with the clerk about items they should not have, pricing minimums, signage they should have, supplied them with all the signage that they were missing, and signed off from there.
And what was the date of that, Donna?
On Sunday. August 12th.
Is there anyone else that would like to address the board before we start asking questions and deliberations? Okay, so we can move on. Amy, I know you're dying to ask a few questions, so go ahead.
But did we close the public? So do we have to close this part of the?
No.
We just want just public. Yeah. Okay. All right. Lisa, I'm wondering if you could tell us how long the requirement to have the manufacturer's notification has been part of Massachusetts law. Like, was that part of the 2019? So that's one of the things I was trying to do. Was it part of 2019, 2018, or 2020? Because there were 3 different.
So the law, it is a little bit confused. So the law was put into place, there was the executive order in 2018, which is probably the first thing you're thinking of, under that Charlie Baker put into place. Then there was the 2019 law that adopted most of that executive order. That was kind of the big tobacco control law. And then there's the 2020 regulations that DPH put out that are part of that law. So they're all kind of the same set. The 2019 law is where the manufacturer letter was first kind of raised as a con. And it wasn't something that existed in towns. It wasn't something that we had been recommending as having in local regulations. So it is kind of unique to the 2019 law, and it requires manufacturers requires retailers to have documentation from the manufacturer stating that the products that they are selling are legal to be sold in Massachusetts. So they're not flavored. And then if it's a general retailer, not an adult only retailer, they have to have under a certain nicotine content, under 35 milliliters per milligram. Or
okay,
it's 35. I don't know the chemistry numbers on that. So it was
4 years.
Yeah.
4 years. And so I'm surprised I can't find the attorney's name, Mr. Tro. Is that it? Are you still here? So if they have all these stores across the state, that since a law that's been in place for 4 years, that they were surprised by that and unable to find the manufacturer's letter for this facility when asked. Also, You mentioned that they had no other legal issues, but it sounds like DOR or FDA suspended their permit as well. Yeah, so it was the FDA suspended their permit.
I think that was a prior store, not them.
Donna, can you speak to that?
Yes, in post they had it posted that they had done a recent inspection there, and they had sent them a letter that stated they were on suspension at the time of my visit. There is.
Yeah, I actually. Oh, sorry.
Go ahead, Beth.
I had actually wanted to clarify in terms of repeat violations. Looking at the violation that was completed, the violation letter. The boxes were checked for first violation, second violation, third violation. And I was hoping to just get clarification of that, whether that's referring to, because I know they changed ownership. Correct me if I'm wrong, in April. So I'm just curious, looking for more information regarding these prior violations, if that's just in reference to the FDA suspension or something else, or maybe I missed it.
Allison, go ahead. Are you responding to Beth?
Yep. Yeah, if that's okay.
Yep.
So the way we chose, Brian and I chose to stack the violation was not in like a time consecutive manner where it was 3 separate inspections, but it was initial violation, second violation, third violation. I think there was, Brian, correct me if I'm wrong, a total of 8 violations that were cited during the inspection. And so, as Lisa was referring to earlier about some communities choose to stack violations in the way that Brian and I chose to in this circumstance, because of the number, because of the nature of the violations in question. We chose to stack the violations as an initial violation, a second violation, a third violation, and so on. And we cited the state regulations and also the local regulations, which is reflected in the fine.
Yeah, I got you now. I understand. Sorry.
Perfect. Meredith, I think is.
Yep. Go ahead.
Oh, I'm sorry. To open a queue. I'm sorry, I just keep getting pop-ups.
Go ahead, Meredith.
Thank you, Madam Chair. So I am the Pioneer Valley Tobacco Coordinator, and we have 34 communities in our coalition currently. And it varies from town to town how they write their violation reports. Some of them, they'll stack the violations as you have here in Easthampton, that it's one inspection and how many egregious violations did they note at that time, and then we'll set the fines and the penalties accordingly. And then other communities just to treat that one inspection and anything that was in violation at that time as a violation. So I've seen it both ways. In the state, there's precedents where we've seen one inspection have a sum total of, I think it was about $29,000 based off all of the egregious violations that they had at that one inspection, and it was held up. So it's really up to the board. I do recommend standardizing it for, the future, but at this moment in time, I've seen it both ways. I just wanted to add that.
Thank you, Meredith. I actually have a question for Attorney Truax or the Patels. I'm a little confused when Donna Bowman presented the fact that there were products that weren't recognized by the payment system that rang up as nothing. I don't understand how, why is that?
I can't answer that. I have no idea.
Do the Patels, are they still here?
Yes, ma'am. So that's probably the items we had it from previous owner or something that so that's why they're probably not drinking up or something. It was there. It's on the shelf itself. So we took them down them.
But Donna, can you step in, because I read in your report during the time of your inspection, someone came in to buy flavored tobacco, so they were being sold even if they weren't ringing in.
Yes, correct. During my inspection, a younger gentleman came in and asked for the banana backwood cigars that were being sold, and the clerk told him that he couldn't sell them at this point. So he from what I could tell, he was a regular customer who would come in to buy specifically those items.
I have another question for either Attorney Truax or the Patels. And Donna, correct me if I'm wrong. You said that there was a sign posted at the store when you did your inspection that said they were under state suspension. Is that correct?
No, there was not a sign. There was not a sign posted saying that. The only sign they had at the time was the state signage that they're required to have that was blocked by some product, but they did not have it posted that they were serving a suspension.
Oh, okay.
I'll clarify you. Post is the state inspection software. So when she said she saw in Post that they were suspended, Post is the state's inspection software.
Sorry, I'm like learning as we go here. I apologize.
It is confusing.
All good questions.
Yes.
We have a couple hands up. Meredith, I think you were first, then Brian.
Sorry, I didn't put my hand down after the last comment.
Oh, okay. Go ahead, Brian.
You're muted.
I apologize. I keep doing that. I have a letter in front of me. So just to clarify on the state suspension that was enacted. So we got a letter dated May 16th of this year from the Department of Revenue stating that Valley Farms had a 60-day suspension of their electronic nicotine delivery systems beginning 12:01 a.m. on June 15th of 2023.
That was the transfer of sale, which happened in April.
Yes, correct. Yeah. We have on record. Yeah, the permit was officially transferred in April of this year.
Okay, so the state suspension occurred after that.
Correct. Yeah. The letter that we received from the Department of Revenue was it's dated May 16th, and the suspension states that the suspension was to begin on June 15th with the duration of 60 days. And it was specifically for their electronic nicotine products.
Attorney Truax?
Yeah, just quickly, Brian, because I wasn't given a copy of that letter. So does that letter indicate when the offense took place, the violation took place?
Yes, in fact, it does. It does say that. It says on May 9th, 2023, the Department of Revenue seized untaxed electronic nicotine delivery systems products from your premises that you held in violation of, and then it states the law sections. So yes, it's an official letter from the Department of Revenue.
Okay, do you mind just send me a letter on that tomorrow? I appreciate it.
Yes, I can do that.
All right, because I want to just follow up with DOR. That just something doesn't sound right. Okay, thank you.
So through the chair.
Oh, sorry.
Did you have your hand up or not, Brian? No? Okay.
I meant to click mute. I apologize.
That's okay. Amy, go ahead.
It sounds like at this point we have some facts. The facts that are sworn testimony by our tobacco health. It's really, and also we have an acknowledgement that they were on site. It doesn't seem like the Patels or Attorney Thoreau is disagreeing that what was found was found. It's really, as a Board of Health, do we want to be able to stack violations that are found that are on the same visit, but of different types, or do we not want to stack? I really think that's the question we have on the table today, because take that establishment aside, this is going to set the precedence for how we enforce tobacco in our town from now on, right? This would be kind of the deciding moment. Does the board agree that that's kind of where we're at, or is there more exploration?
No, I agree with that. And I think also like I'm trying to look at this from a local town perspective and what we're citing them for, and how much to weigh in the fact that there was a state suspension at the same time. Like, I think I'm trying to just focus on the town, our town, and how we're going to enforce, this with businesses in our town, and not focus on the state thing. Because in my opinion, like, it seems like it's like, sort of makes the offense worse, because there were all these violations and they had already been cited by the state. But I don't know if I should tease that out from what we're focusing on as a town. And I don't know what your opinion on that is, Amy.
It seems like the letter that Brian read is that the state came and seized items from their property because they weren't being taxed. And you can't ring in products that are illegal to sell in the state and pay tax on them, right? So it seems as though they seized property that shouldn't have been being sold, right? So I would say it is actually relevant to what it is we're talking here, because the claim of "I didn't know" seems like it's not a viable.
Right. I agree with that, Amy. I think we do have to consider it, because it may be different product, but they're tobacco products. And also the fact that Amy brought up earlier in the meeting that the manufacturer letter is a 4-year-old law. Flavored tobaccos, or the vaping stuff, have been illegal for quite a while now. It didn't happen this year. I can't remember exactly the year that was made illegal, along with the minted flavored products. So the fact that it's been identified that the owners of Valley Farms also own numerous other stores in the state, even though they're new owners as of April 2023 for Valley Farms, they own other convenience stores and should be aware of the state regulations and laws about tobacco products. That's my sense on the situation at this point.
Yeah. And that's kind of why I think I, as a board, if we set aside kind of this experience and we think through, do we want to stack violations for egregious violations in one visit per category, or is it one visit, one fine? And that's, I think, what we need to decide. And then we can talk about what we're going to do with this specific case. But as we're setting precedent, if we start there and kind of set aside Yeah.
So do we want to make a motion to vote on that tonight, or do people feel like they need more?
I don't think we need to set policy. I think we're just thinking about, like, as a board, what do we want to do?
Okay.
What do we want to do? And if we, not something official, just more like, do we think that we want to stack, or is this something we don't want to do? Not any policy, not any regulations, just a matter of practice.
Yes. Personally, if they are egregious violations, as an example, this particular case, I agree with the stacking. But we can't always just look at this one case. I mean, the word egregious means to me that it's someone who, it's not a first-time violation. It's, there are other factors that play into a description of egregious. And I personally feel that stacking is applicable.
I agree, Maggie. I think for egregious violations like this one, moving forward, given that we are I think as a board, we work to protect the youth in our community in a variety of ways. And these products are known to specifically, these nicotine products, to target the youth of our community. And the inspector, while she was on site, saw someone coming in trying to buy these. I think they are egregious and that we should stack in these situations. Beth?
Yeah, I am inclined to agree. I think that when these violations happen, usually the like you said, Maggie, it's not a surprise. Everyone knows that you're not supposed to sell those at this point, right? Like, so I think it's whoever is selling them knows they're selling something that's illegal and shouldn't be sold. So I would tend to agree that we should stack violations in those situations.
Okay. So I think if we're all agreeing that egregious tobacco violations in our community will be upheld in a stacking manner if multiple are found during a single visit, I think now with that kind of set, we can, now that we all agree on that, we can kind of now talk about this specific case. And
yep.
I'll leave it to you, Maggie, as the chair, to start if you want to start the discussion.
Yeah, I mean, so there's two things with this particular case. There's the stacking of the violations with $8,600 fine, along with a 30-day suspension. Based on the information we've heard tonight, I think that we should vote, or I personally would like to vote to hold them accountable to both of those things. The fact that they were under the state suspension, the fact that they own other stores in the state, and I'm surprised that they're not aware of all of these rules and laws and regulations. So that's where I stand.
Yeah, I agree with you. Everything you just said, I would, I would definitely hold them accountable with both.
Great. I would also vote to hold them accountable.
So
I can make the motion if you want.
Yep.
So I vote to hold the cease and desist order dated September 12th, 2023 as it stands.
I'll second that motion.
All in favor, Maggie, yes.
Beth, yes.
Amy, yes.
Okay.
Do we need to vote to close the public hearing?
Yep.
I make a motion to close the public hearing and move back to the agenda.
I second that motion. All in favor, Maggie, yes.
Amy, yes.
Beth, yes.
Okay. So we can move on to the housing issues, Brian.
Sure. Let me grab the paper, sorry. So I just had two quick updates on just some housing cases that we've kind of been dealing for a while during the summer. 140 Everett Street, as we mentioned before, was in June, was officially put under ownership of the city due to unpaid taxes. I conducted an inspection there. The city requested it. I found significant unsanitary conditions, along with, a significant animal hoarding. There were animal control ended up getting 12 cats out of the house. So actually, the house was actually sold last month. The condemnation still is in effect until they contact us, and I do the inspection to lift it. I've spoken to the new owner. So that's it for 140 Everett Street. So hopefully everything gets cleared up with that in the near future. And then the other property was 26 through 28 Federal Street. As we had stated at the previous meetings, this property went into like an ownership limbo due to the property owner passing away at the beginning of the year, and then no family wanting to claim the property. So it went into this limbo where we couldn't really cite it to an official owner. I've been keeping up with communication with the bank. The house was bought last month, but it still hasn't closed yet. So I guess there was some additional paperwork requirements on the buyer's end. They extended it for 30 days. So at the end of this month, they should have it closed. I spoke with them most recently last week, and it still hasn't closed as of last week. They told me that they were going to contact me once it closed on the sale. I did stop there a week ago, and I spoke to the tenants, and they told me that the fly problem did subside. Yeah. She also did tell me that the new owner, or what she thought was the new owner, already went in there and cleaned the property out. So I mentioned that to the bank, and they're like, "Oh, well," because I was like, "Did it close?" Because I was told there was an owner in there. But according to the bank, it has not officially closed yet. But yeah, like I said, I was pointed out, and I visually saw from the windows. I couldn't see any fly activity like I did.
Oh, good.
Yeah, like I did before earlier in the summer. So yeah, so that subsided at least for that. I do know that she does have the current existing tenant has some leaking problems and has some mold up on their kitchen ceiling. So when it does change ownership, I'm gonna make sure that gets followed up, because it is something I did observe.
Okay.
Yeah, and that was it. Those were just the 2 housing updates.
Thanks, Brian. Great job.
Yep.
Allison, was there something else you were going to come back to? I can't remember now.
I'm sorry for the redundancy between my report and the agenda here. I think my intention more around having this item be separate was to just see if there was any discussion or questions about the transition of the Healthy Youth Coalition, and just to acknowledge that, we did have to fire an employee, unfortunately, from the coalition before their transition period out. So it's been a little bit of a rough road in that arena.
Is there anything that you need from us to help you along?
No.
Or?
So we've issued, because of the incident that happened in the community, which took place at Easthampton High School, with a staff person from Case Passage in Northampton. Myself, the mayor, and the superintendent from the Easthampton School District all wrote a letter together of apology from the city to the individual harmed in the incident, and we're still working with Safe Passage to be a partner with the city and to see how we can continue to mend the relationship between us and that really important community.
Okay.
Yeah.
All right. Well, hopefully we get some applicants that are worthy. So, does anybody else have any other items? It's just us, I guess.
No, but I would like to know when our next meeting is, just to make sure I have it in my calendar.
It's October 18th. It's a Wednesday. Yeah. And the meeting link, it'll be on the agenda, but the meeting link will be the same as this one today. So
is that recurring link?
Yep.
Okay.
Yeah, it's our link until the end of 2023, so December.
Perfect. Thank you.
All right. And I really thank Beth and Amy for making this work so that we have a full board. And I know that it's difficult, but I just want to acknowledge that. So,
yeah, I apologize that the last 2 meetings I've started on my phone while driving, but
that's okay. You got to do what you got to do.
I work a lot of hours and I don't want to stay at work for the meeting and then come home. So I really try to get out of there early enough to be able to.
That's okay. That's all right. Yep. All right. So are we done? I'm going to make a motion.
I think so.
Finito, so we can all enjoy our evenings.
I will make a motion to end today's Board of Health meeting at 6:41 p.m.
I second that motion. All in favor? Maggie, yes.
Amy, yes.
Beth, yes.
Yay.
This government meeting is brought to you by Eastworks and our local cable subscribers.